Hi there, I'm Dr. Chung and welcome to your friendly proctologist. I'm about giving you real helpful and useful information. Thanks for subscribing and liking this video. I appreciate it very much. The question somebody asked for today is, can you compare the recovery of a hemorrhoidectomy to a removal of a skin tag or external hemorrhoid, right? And that's a great question because when we're thinking about what we want to do, we want to compare these things, right? It's important information. So before we get to answering that question in detail, I want to give a shout out to Pranicura, who's been a sponsor of this channel for about a year now. It's amazing how well this partnership has been going. I encourage everyone to take the 30-day Pranicura challenge, okay? Go to the website www.pranicura.com so you can find out how this cream can help you. There's so many reviews and testimonies of people on my video comment section or on their website that I hope you get inspired to help you with your hemorrhoid issues, anal fissures, itching, or just anything else that may not be going right down there. Encourage you all to try this so that you can take part in the benefits that it gives so many different people. Pranicura is shipped internationally around the world, so go to the website and see how you can get your own jar of this fantastic stuff. Okay, so let's go into the excision of the skin tag first. And I do this procedure in the office all the time. Surprised? Yeah, me too, because I'm surprised at how much I can do to the bottom end in terms of these procedures. And we don't have to go to surgery. It's amazing. And so I numb you up, I cut the guy out, and I put some stitches in. And so you have a cut, but it's on the outside of the anus because I can't go inside too deep, right? You're wide awake. So the pain of that cut and stitches, yeah, it does suck, but usually it's about 3 to 4 days where people are getting support of prescription pain medication. After that, usually ibuprofen and Tylenol are enough because the pain is usually only with the bowel movement or the pooping, right? At 2 weeks, the wound is usually about 85 to 95% healed, and so people are getting back to their old lives again, doing things they want to do pretty quickly. Now, if we talk about the hemorrhoidectomy, okay, that's a completely different thing. And I just want to let you know the removal of skin tag and the hemorrhoidectomy, apples and oranges, right? Pretty obvious. But I want to impress upon you, not everyone has the opportunity to pick a skin tag removal or the hemorrhoidectomy. Why? Because the treatment may not fit your condition of the hemorrhoids, meaning that some hemorrhoid treatments may be too much or it may be too little, not enough, and your goals for treatment, you want to feel better, may not be met, and you may be very unhappy with the results. So if you have a giant, large hemorrhoids that are coming out, for example, let's take the extreme, and someone offers you a small hemorrhoid removal in the office, yeah, that patient is not going to notice any difference. They're going to have pain from the procedure, but they're still going to have the other hemorrhoids that are popping out and large and swollen. The other end of the spectrum is the patient has a little ditzel, a little skin tag on the outside, and the surgeon says, you need a hemorrhoidectomy, ma'am, sir. That doesn't make any sense either. So you see how the procedure needs to fit. But there are some times where, yeah, you can go either way, or there's lots of different options. And that's why the consultation is so important. The surgeon needs to see your hemorrhoids, advise different treatments, different strategies to see if you will want to take one of them or figure out how to get yourself feeling better with the least amount of recovery is probably most people's strategy. So let's go into the hemorrhoidectomy recovery, right? The pain is much worse. The time course of this healing is much longer, okay? Because why? The surgery involves removal, cutting out the hemorrhoids of the inside and the outside, right? Very much longer cut or incisions, and then the stitching needs to happen from the inside all the way to the outside. Next, it may be 3, 4, maybe 5 different areas of your bottom end where you need that cutting and stitching done. Okay, now if you compare that with the smaller procedure, we're talking about many more times the distance. So then the pain and the inflammation goes up that many times. Okay, so yes, the pain is harder to deal with, and the pain also lasts longer. Typically, the first 2 weeks are the roughest for hemorrhoidectomy surgery, right? The recovery is longer too, and so the pain with the poop usually can last up to 4 weeks even. Of course, it gets less and less each day as you go, but compared to a skin tag removal or external hemorrhoid removal, yeah, it's about twice as long. And so the big thing here is, what does your body need? Okay, you don't want to be offered banding for large hemorrhoids because it's not going to work. You don't want to waste your time. You don't want to risk unnecessary complications. You'd rather have the job done right the first time and then not have to worry about your hemorrhoids, right? So again, having a surgeon who is considerate of your questions, who will spend the time with you, and who can be dependable for you to call when you have questions. Be there for support to answer concerns, anxieties, refill pain medications, change pain medications, give pain medication strategies, talk about different pain medication injections they can give you, he or she can give you. That is important. When I provide the hemorrhoidectomy surgery for my patients, it's about supporting and being a coach, right? You've never been through this kind of recovery, and I've seen it hundreds of times, so I know what to help you with. I know to make sure you get to pooping early. I know to make sure that your pain is well controlled, how often you can take, how much pain medication you take. Is that a side effect? Do you need to change a different pain medication strategy? On and on and on. And what happens when you have that coaching? Well, your pain is much less, your anxieties are much less, and that light at the end of the tunnel, it's much brighter, it's a lot closer to you, and makes the recovery so much easier. And so I hope this video really helps to kind of delineate those two procedure recovery in case you didn't have that discussion with your surgeon. But again, remember, it's primarily, number one primary focus is, what procedure is right for me, doctor? That's what you really want answered first. So going on with our hemorrhoid discussion, I fully encourage you to take the Pranicura 30-day challenge. Jump on the ship with everyone else that's out there suffering with their bottom end. Go to www.pranicura.com and read the reviews. Learn about this as much as you can, and join us when you're ready. I hope you take care and have a good one. Bye-bye.